There's a troubling epidemiological pattern we're observing. Children from immigrant families transitioning from traditional diets to Western processed food patterns show dramatically increased kidney stone rates within one generation. This diet-disease relationship provides powerful evidence about the role of modern Western eating patterns in kidney stone formation. The epidemiology is striking and consistent. Immigrant populations from regions with traditionally low kidney stone rates, parts of Asia, Africa, and other areas, develop Western stone prevalence within just years of immigration. Children acculturate faster than their parents, adopting American dietary norms more quickly and completely. In the process, they lose protective elements of traditional diets that their bodies evolved consuming over many generations. Specific dietary transitions drive this increased risk. Traditional consumption of water and tea gets replaced with sodas and sugary drinks. Fast food and processed snacks become dietary staples, replacing home-cooked traditional foods. Protective foods from traditional cuisines, certain vegetables, fermented foods, preparation methods that reduce stone-forming compounds disappear from regular consumption. Portion sizes increase dramatically compared to traditional eating patterns. Cultural factors accelerate these unhealthy transitions. Pressure to assimilate drives adoption of American food habits. Children desire to fit in with peers, seeing traditional foods as marking them as different. Western processed foods are sometimes perceived as status symbols or special treats, making them more desirable than traditional foods. Parents working multiple jobs may rely on convenient processed foods rather than time-intensive traditional cooking. Prevention requires culturally sensitive approaches that preserve protective dietary elements while navigating the new food environment. Traditional diets often contain elements that protect against stones. We should identify and maintain these. Community and religious leaders can be powerful partners in health education, reaching families through trusted cultural channels. Providing resources in multiple languages ensures information accessibility for parents with limited English proficiency. I've collected family stories that illustrate this pattern. Immigrant families notice their children developing health problems not seen in the home country: obesity, diabetes, and kidney stones among them. Intergenerational conflicts emerge over food choices, with children rejecting traditional foods and parents feeling helpless to maintain healthy eating. Success stories show that hybrid approaches are possible, maintaining protective traditional dietary elements while living in America. This exemplifies a broader phenomenon known as the immigrant health paradox. Newly arrived immigrants are often healthier than native-born Americans despite lower socioeconomic status. But this health advantage disappears with time and acculturation. Kidney stones serve as one marker of this transition. As immigrants adopt Western dietary patterns, they adopt Western disease patterns as well. The implications extend beyond individual families to community and policy levels. We need culturally appropriate nutrition education that doesn't simply impose American dietary guidelines, but builds on traditional foodways. Addressing food environment challenges, making traditional ingredients accessible and affordable, supporting ethnic grocery stores and markets, helps families maintain healthy eating. Recognition that Americanization of diet carries real health costs should inform public health approaches to immigrant communities. For immigrant families, the message is both validating and cautionary. Traditional diets often were healthier than what's readily available in America. Maintaining those dietary traditions isn't just about cultural preservation, it's about protecting health. Children can integrate into American society without adopting its most unhealthy dietary patterns. Balancing cultural maintenance with adaptation, preserving traditional foods while navigating new environments, protects both identity and kidney health across generations.